So I'm going to talk about suturing. So you need to hold the needle at 2/3 and 1/3 of the distance so that you don't crush the needle while suturing. And this ensures that you have an adequate grip as well. Then you're going to enter through one side of the skin, and we're doing a simple interrupted suture. So you need to ensure that the depth that the needle penetrates is equal to the distance. You want to form a hypothetical circle when you're doing so. So here, if you do it this way, you come out at the right plane, and I personally prefer to take out my needle through one side before I introduce it through the other so that the needle does not bend. So here I'm taking it out, and then at the right level and distance I'm introducing it to the other side so that the distance of entry and exit are equal at both sides. So now you gotta tie the suture material. Ensure that you don't apply too much tension, you just want to approximate the wound edges. So I'm tying a surgeon's knot, so I'm putting 2 on the first row, and then on the second I'm putting 1 throw. As you can see, the knot is now formed and the surgical site is closed. So when you're using a non-absorbable suture, you need to cut the suture material far so that it's easy for you to remove it later on. Okay, so now we're going to use the mattress technique, and I'm going to teach you the vertical mattress technique. So you enter through the one side, keeping the same distance principle that I told you before. You come out at the right plane, and you're again going to go in at the same plane, and you come out at an equal distance. Note that the first throw is far, or you enter and exit at far distances. Now the vertical mattress suture is to ensure that there is eversion of the wound margin, and the next suture throw is going to be in the reverse direction and is going to be relatively superficial. Note that this is also closer to the wound edge, and this is to achieve the eversion of the wound. So now you have these suture marks in a vertical line that ensures eversion of the wound, and now I'm just going to tie it with the surgeon's knot. You see that it's well approximated. And again, since I'm using a non-absorbable suture, I'm going to be cutting it far so that it's easy for me to remove it later on. So now this particular suture is quite good if you want some cosmetics, because the eversion achieves a better cosmetic approximation. Now the next suture technique that I'm going to be showing you is the horizontal mattress suture. You can see I'm using the same principle and coming out at the right plane. If you note here, quite paradoxically, the horizontal mattress suture requires you to go vertically. So here I've entered far and exited far. The next one is going to be below the exit mark of the first suture site. Here you can see that I'm going below that. And ensure that your distance is also correct. It should be approximately equal to the same depth that you go and to the distance of the wound. Now here you can see that I'm coming out at the right plane. And again, I prefer to take my suture out at each side so that I have a greater control of the distance. So there you have it, a horizontal mattress suture. Now what I'm going to do is I'm going to tie a surgeon's knot and close this wound. Now, the advantage of this suture is you have better hemostasis with the horizontal mattress suture compared to the vertical one, although it does cause a lot more tissue damage and strangulation of tissue in between the sutures. So it may not be your number one choice if you wanted to go for a cosmetic type of suturing. But that being said, it is still quite good if you want to achieve a good amount of hemostasis and you have a lot of bleeding that's going on. So now I'm just closing it with the surgeon's knot. And I'm going to cut it far off because this is a non-absorbable suture. So next type of suture that I'm going to show you is going to be the figure of 8 suture. Now, in the figure of 8 suture, you want to ensure that you have a greater amount of hemostasis. So using the same principle, I'm coming out of the right plane. Adjust the depth according to the distance and the distance according to the depth, and you come out to the sides. Now, this is quite similar to your horizontal mattress suture, but the only thing is that I'm going to ensure that it comes out through the same entry side so that I create a hypothetical X when I'm suturing it. See that I'm entering at the same site of the first entry. Then I'm coming out through the other side, ensuring the same principle. Now the figure of 8 can also achieve a good amount of hemostasis, and it tends to be more easier to do because you don't have to reverse your grip when suturing. So now as I pull the suture, you can see that forms an X. One limb of the X is on top of the skin and the other one is below it. And when I tie the knot, also it forms an X. So you need to ensure traction while you're doing this suture, and you close the X without any gap. So this will give you a good amount of hemostasis. And again, I'm cutting the knot far because this is a non-absorbable suture.